schizophrenia in A Beautiful Mind.
In the movie A Beautiful Mind, the main character, John Nash, is described as an arrogant, awkward, and brilliant man. During his time in graduate school, he would not attend class because he believed that it limited the creative mind and he preferred to work on his thesis. He attended Princeton University for his graduate degree. John is the only student from the South, and several of his northern peers have published papers already, so John is the outsider from the group. The graduate program comes with a lot of expectations and stress due to John's ambition. Because John is friendless in a competitive environment, his mind creates delusions.
The disorder the main character had was schizophrenia. A patient with schizophrenia can experience hallucinations, delusions, disorganized speech, disorganized behavior, and a lack of emotional expression and interest. The diagnosis would still be schizophrenia, considering the movie's cultural context, because he actually does get diagnosed with schizophrenia in the film. This disorder might not be diagnosed in all cultures. For example, some cultures might disregard mental disorders entirely by claiming that they are not real, or that the individual is exaggerating. People might be afraid of schizophrenics because they think that they are violent, or that they have split personalities, so they do not know how they will behave if they interact with them.
Hallucinations. Charles, John's roommate, is introduced early in the movie. It is not explicitly stated that he is a product of John's delusions until the psychiatrist realizes it. Additionally, he also imagines Marcy, Charles' nephew, William Parcher, the man working for the U.S. government, and his army of spies. Persecutory delusions. When he is giving a speech at Harvard, he stops in the middle of it, noticing some suspicious-looking men in the back of the auditorium. He believes these are Russian spies that want to capture him, so he runs off of the stage. Memory loss. This symptom is not shown in the film, but it does occur in real-life patients and affects daily functions.
Our proposed treatment plan would be to recommend doses of clozapine because it is what is most commonly used to treat schizophrenia in today's medicine. There are little to no ethical concerns other than the side effects caused, which are weight gain, constipation, and dizziness. The barrier that hinders John Nash from receiving this treatment is the little knowledge known about schizophrenia at the time.
Aspects of the portrayal of schizophrenia are accurate and some are not. For example, the film showed many positive symptoms, like hallucinations and delusions, when in reality, negative symptoms are more common in schizophrenics. On the other hand, its portrayal on medicine was accurate. It showed that the medications did not get rid of all his symptoms, and that it came with side effects.
The film's portrayal of this disorder influences our understanding of schizophrenia because of the representation of the unusual acts. This gives us the understanding that the functions that were progressed by John happen to people in reality. Without treatment, just like John refusing to take his medication, individuals have vague images and thoughts, creating an impaired human being that could injure themselves or others.